started because it is 11:30. We will give everybody a few minutes to join in, but we do want to respect everyone's time. We thank you so much for joining us today for the Women's Health and Pregnancy webinar. We're going to really focus a lot on the impact of COVID-19 and that it's had on women and children in Haiti. We all know earlier in Haiti, in March, there was a lockdown, a shutdown. A lot of healthcare facilities were closed, and it's had an effect on women.
Bonjour tout le monde. Nous bien contents que nous retrouvions pour le séminaire ça. Nous connaissons que COVID-19 a causé un peu de changement en Haïti et nous connaissons quelques centres de santé qui étaient fermés à cause de ça. Et nous avons commencé ce séminaire-là. Nous allons commencer par partager quelques informations sur Haiti Health Network et puis nous avons commencé. Si nous allons répondre à la question ça, dans quelle langue nous avons aimé ce séminaire-là, la aider nous pour nous connaître dans quel niveau de traduction nous avons supposé.
I just launched a poll asking about language preferences for today. It helps us to understand how much translation we need to do. We obviously, as you met Marie-Claire, she will be here to do the translating. I am Barbara Campbell with the Dalton Foundation and the Haiti Health Network. We've got Dr. Kaplan on, who's with the Haiti Health Network as well. Marie-Claire is with us at the Dalton Foundation and the Haiti Health Network to facilitate today. All of the slides that we have will be translated, so that will help with the language as well. I'm going to let you translate, Marie-Claire, while I switch my slides.
Oh, ok. Nous gagnons Madame Barbara Campbell, qui est directrice Dalton Foundation, qui est là avec nous, Marie-Claire Charles, moi-même, avec Dr. Ted Kaplan, qui va faciliter séminaire ça. Comme tu dit nous déjà, avec les questions nous t'es posées pour nous connaître combien de monde qui parle anglais, combien de monde qui parle créole, pour nous connaître dans quel niveau de traduction à pied. Toute présentation nous gagnons, yo déjà traduit en français, alors n'a qu'à suivre avec nous, n'a pas dans tous les deux langues.
Okay. For today, I'm going to introduce our panelists to you. The format will be, everyone will go one at a time. We'll have everyone share a little bit about their work. And then at the end, we want to leave time for some question and answer. And please type your questions into the chat box or into the Q&A box, and we will try to get everything answered.
Et pour matin, nous pourrons chaque panéliste a bien temps pour partager et nous gain côté nous qu'a écrit question dans notre chat côté qui marque chat là avec Q avec A pour question, que n'importe question nous gain nous qu'a écrit là n'a pas adressé après.
Based on our polling with, I think it ended up being 92% English, 8% Creole, we probably won't translate every word, Marie-Claire, as our speakers are speaking, just because there is a lot to go through and a vast majority of English. So if everyone is okay with that, that's the purpose of that polling, just so we can understand. We do have all the slides translated. We will send out all of the slides to everyone. And Marie-Claire, I'll probably just have you do an introduction of everybody in Creole as we go forward.
Okay. Et j'en ai dit à question nous fait nous connaît que gagner 92% monde qui a participé qui préférait l'anglais et gagner 8% qui préférait le créole. Alors nous gagnons pile matériel pour nous partager, n'a traduit l'essentiel, nous pas traduit mot pour mot tout bagaille et puis après séminaire là n'a partagé et n'a partagé présentation pour tout le monde qui a accès à lui.
Thanks, Marie Claire. I want to go ahead and just turn this over to the speakers right away because I'm really excited about this topic. And our first speaker is the reason that we're having this webinar at all. She was sharing with us one evening about what they're seeing in their work in Haiti as a result of the COVID lockdowns and the quarantining. And it really broke my heart. I think one of the things we frequently talk about on our Haiti weekly calls, they were weekly back then, is about not only COVID, but this, I call it the side effects of COVID. What our focus of COVID did and how it has affected other people, right, and other groups that may have missed out. And I think the women and children are definitely in that group when healthcare services began to shut down or were more limited. It affected women dramatically. And so, Catherine, I want to turn it over to you so you can share with us what you've been seeing.
Okay. Thank you so much, Barbara, and thank you for hosting this because it is a topic that I think is timely for us to be talking about. So I'm the co-founder and executive director of Lide Foundation, and you know, we work with adolescent girls primarily in Haiti, working towards resiliency, but taking a whole person approach to that. So having programs that do psychosocial skill building and resiliency building through the arts, having programs that do informal education, basic literacy, as well as tutoring to support girls through their academic goals, and also having a healthcare component by having nurses at our programs and embedding things like sexual reproductive health education, early childhood development education. This has always been a part of our program. And, you know, during the lockdown, we can probably go to the next slide. And the next slide. During the lockdown, as a result of it, we have been seeing, as we've been going back to programs, that our rates have more than doubled of teen pregnancies. You know, no one who works with adolescent girls in high-risk situations is going to have no pregnancies in a year. But in one region of the Artibonite where we work, the numbers went from a maximum of ever having 4 and usually just 1 or 2 to suddenly having 13. And so that was a significant jump in rates in that location. And so we began to be concerned about this and the overall health impacts and life impacts to the girls. You can go to the next slide.
And just quickly, I just want to give a little overview of what you said in Creole. Madame Catherine Adam, c'est un fondateur organisation l'idée qui travaille avec jeunes filles qui aident dans résilience, dans éducation à travers art et travaille dans plusieurs régions en Haïti. Et c'est un monde qui était aider venir avec l'idée. C'est une raison que nous gagnons séminaire ça parce que dans un appel que nous avons gagné, comme nous gagnons un appel chaque 2 lundis sur COVID avec l'autre aspect santé à travers Haïti, il était fait remarque que il y a un pile jeune filles qui a retourné qui est enceinte et ça a une inquiétude pour lui et ça a une inquiétude pour nous tous. C'est ça qui fait nous ouais, importance pour webinaire ça. Alors, et la présenter travail que il fait et situation, comment situation est dans l'organisation par là.
So, you know, during the lockdown and this past lockdown being different than previous ones from violence, with schools being closed, the life of a girl changed drastically. She was expected to do the household work. We were constantly reaching out to and checking in on our girls throughout the lockdown and discovering that they were basically working full-time at home, gathering water. You can go to the next slide. cooking, cleaning, doing the laundry. You can go to the next slide. And quite often left at home in charge of younger siblings or just doing these duties on their own in situations like many of you who, you know, all of us know Haiti who are on this call, in LACU situations where you have many extended family members living in the same compound together, quite often bedroom sleeping arrangements being shared as well. You can go to the next slide.
Et yon nan bagay ke nou te wè, se ke an pil jen ti fi ke nou travay avèk yo, pandan mouman konfinman, yo rete la kay, men yo pa rete konsa, yo fè an pil travay, so yo lave veso, e nou te wè kek nan foto ki ta pase, yo al chèche d'lo, lave, bale, netwaye kay, e an pil nan yo rete nan zon kote ke nou rele zon lakou, kote gen plusieurs moun ki rete ansam nan ti kay tout piti.
We'll go to the next slide. So, you know, looking at those situations that contributed to this, the school closures, of course, being a primary one. Without school almost being an escape for girls from household work in Haiti, quite often, especially in rural areas and in impoverished communities. The continuing violence and instability was also a contributing factor, leaving girls feeling very insecure, feeling uncertain about not only their future, but their present. There has been an even greater normalization of not going back to school, not continuing with education, even as schools have returned, due to the economic pressures, and therefore just kind of being like, well, it's okay, just your mother worked in the fields, you can work in the fields. So not a real push to get kids back into school, and a lot of that being people can't afford it. As I mentioned, the LACU style home settings can sometimes increase dangers. There's also a high number of instances of exchanging sex for basic needs. And this is something we've seen for years working in Haiti and heard from girls directly, that for food, for clothes, for phone minutes, sometimes for school tuition, that they will exchange sex for those things.
Et an pil nan sa Madame Catherine a pataje, an pil Haitien nou ka kompren situasyon, an pil nan ti fi sa yo ki rete nan kay, ki vin anset tou, yo automatikman retire yo l'école, et nou ka wè traduksyon yo ki tre, saldia ki tre kler nan slide la, kote ke gen yon stigma ke ti moun an depil anset nou konen ke la vi fini pou li. Et se yon pi gros problem ke la renkontre kote ke ti moun an perdu espoir, li pa konen ki sa pou fè, li kache grossesse la, et ainsi de suite, nou ka imagine.
Another big factor that I'll be getting into in just a moment is loss of hope. Being a significant factor, and related to that, a belief that pregnancy, being a mom, is an escape from the insecurity, the uncertainty in their future. If you don't know where your future is going, but you have a baby, you know you have that one thing that needs you and you need it. And also a kind of myth that some man is going to save you. And compounding that, there's, in the countryside, a lack of availability of birth control, not because nearby communities don't have it. If you go into city centers, you can get it. But many of these girls don't have the ability to go into a city center due to their poverty. And then where it is available, there is a huge pressure from boys and men not to use birth control. And we hear this a lot from our girls, to the point of where they feel threatened if they were to try and use birth control.
Et yon nan histoire que nous entendons en pile de la part de jeunes filles et qui inquiète nous en pile, c'est que yo recevoir pression parfois dans mes garçons yo qui obligé ou pas utiliser contraceptive yo soit yo peur, ça vient rendre yo peur et yo obligé obéir parfois et yo pas qu'à partager genre de information ça avec mon qui proche yo et parce que yo peur pour la vie.
So I was looking at the instances and some of the factors that may have been similar among the girls that were getting pregnant, and noticed some general patterns. And so I put together one person as a typical case study, so to speak, of some of these factors. And so Jenny, who is that's a made-up name, but a Creole one. But age 16, so this is representative of one of the girls who's pregnant, living in a rural farming community in a laku, 14 people living in that laku area with 4 little huts kind of together, as many of you have seen. Sometimes it's a single room situation. Sometimes they'll split it where the front half is one room and the back half is another room. But she is left at home all day to take care of her younger siblings, cook, do laundry, get water. She's 4 years behind in age to grade level. That was common throughout the girls who got pregnant. All of them were significantly behind, one of them as much as 6 years. In looking at psychological assessments that we had done previously with these girls, we do something called the locus of control, which kind of assesses their sense that they have control over their own lives. And she was scoring around 46% on that. And on a resiliency scale, we use the CDR. She was basically below 50% whenever that was done. So low resiliency, low sense of control over her life. And then during the lockdown, we were using the Zamila Santé depression scale that they've developed, and noticed that she had basically 60%, which if you were to translate that into like a depression scale in the States, it would be equivalent of saying this person has a depressive disorder.
Toute information ça yo nous ka wèl nan traduction c'est ka Jenny qui c'est un nom qui pas que forgé qui que te rencontré avec un cas.
So we're seeing in the general mental health during the lockdown, we noticed 48% of the girls that were assessed were showing clinical signs of depression, enough to warrant great concern. 29% of those were severe, and all of the ones that were severe were ages 15 to 20. We work with girls as young as 10 and 11, so it was interesting to see how the older you got, the more those factors started adding up. And finally, the most significant one was feeling hopeless or discouraged about life.
Et yon ka nou peut-être nan culture haïtienne nou pas tellement basé sur la santé mentale, dépression c'est yon nan ka que te trouvé en pile nan ti moun yo et yon nan parole yo dit souvent c'est que yo senti au kagou, yo senti la vie finie et tout ça.
So the impacts on a girl's life for this are of course lifelong. Her future, her trajectory is forever changed in that moment. As soon as she is discovered as being pregnant, she is removed from school, and the opportunity to return is very limited. She will often continue in a cycle of poverty. There is almost always lack of, meaning absolute absence of support from the father or responsibility for care or support of the child. We also have noticed that it almost triggers a repeating cycle of this, that child number one leads to very soon child number two. And that, of course, leading to limited employment opportunities throughout her life as she has children to take care of.
Et nou ka wè impact que grossesse précoce gen la kay an jeune fille li dure toute vie li. Et nou ka imaginer depuis le commencement l'école, yo quitté l'école et puis grossesse qui continue durant toute la vie, ça vraiment fréquent la grossesse précoce.
So some of the concerns that we have is that girls normally hide their pregnancies, often until the 4th or 5th month. With the lockdown, that hiding became even more severe. And especially because they were afraid to go into city centers or to clinics during the COVID lockdown. With the growing hunger crisis that we currently are seeing in Haiti, which is related to a drought and just general food insecurity as well as COVID, we have concern about their overall maternal health and the fetal health. Teen pregnancies are more prone to birth complications if not handled properly. And many of these girls seek out unsafe ways to abort the child. Sometimes they'll say they're going to the countryside, which means even further remote, to see a voodoo priest or someone in the countryside who will try and get rid of the child. And we've actually seen cases where this has led to major health complications for the girl involved and almost threatening her life at times. So that's a great concern.
Et j'en ai dit tout à l'heure, il y a une autre gros inquiétude, c'est que les jeunes timoun yo caché grossesse yo, et ça vient cause que yo pas recevoir service santé, soins que yo t'avance supposé jeunes qui viennent liés à l'autre complication. Et ensuite, en pile nan yo aller pour yo faire avortement de façon qui pas sanitaire et qui cause en pile l'autre gros dégâts.
The things that might help in this situation, one of them is a huge wish, and it probably is not realistically achievable, but it must be mentioned, is universal education. UN Women has studied this situation, and the longer a girl continues in school, the less likely she is to get pregnant, and that it actually is a better form of birth control than birth control. So I must mention that as something we should always be working towards. But in the meantime, we need sexual reproductive health education for girls and boys, especially given the way girls are pressured not to use that birth control. We need greater access to maternal health clinics, especially in or near rural communities. I know many members of the Haiti Health Network work in this area and are doing great things, and we'll be hearing from them today to bring this kind of care into the countryside and to these kind of girls, but more is needed. We also need to try and destigmatize seeing a doctor for teen pregnancy. I've seen cases where even my staff have accompanied a girl to see a doctor, and she's been humiliated by the staff for being pregnant, shamed and blamed, making it not comfortable for her to go back and seek the care that she really needs. So I think that's an important thing that we can control and we can make a difference in. So thank you so much.
Thank you so much, Catherine, for sharing with us and giving us a great overview of the problem and what you're seeing at the, as the lockdowns eased. I want to move right along because we have several other wonderful panelists to share with us today. I'm going to turn it over. Next will be Kay Sandberg with the Global Force for Healing. And then after that, we're going to go down to Haiti and hear from the front lines in Haiti from Hôpital St. Croix and Léogâne. So first, Catherine, I will turn it over to you. You're muted, Catherine.
I'm actually Kay.
I'm sorry, I'm calling. I apologize
already. Thank you very much, Barbara and Marie Claire and Dalton Foundation for this opportunity. I'm the founder and executive director as well as convener of the Compassionate Birth Network. And that's comprised of 17 partners in 11 countries, including 4 partners in Haiti. That's where the largest number of our partners reside. I'm a passionate advocate for the right to voice and choice over personal choices regarding childbirth, sexual reproductive health for girls and women. And I'm going to focus today really more on Haiti after doing just a little bit more of an introduction to the issues around COVID that I see worldwide, well, at least in the 11 grassroots organizational countries where we work. Okay, next slide, please.
Sorry, my cursor is, I apologize.
Et merci, non, moi c'est Kay Sandberg, c'est fondatrice et organisatrice organisation ça qui travaille en Haïti et dans 11 autres pays dans le monde là. Nous travaillons avec jeunes filles et femmes dans la santé de la femme.
Okay, great. Let's go on to the next slide, please, for the sake of time. So our 4 network partners in Haiti, and I'm thrilled that, that one of you, Jane, is here from Midwives for Haiti to speak directly. And I will give a couple of examples myself and then ask Jim Grant, who is one of our participants today, to talk about Maison des Naissances, where he is executive director in the Torbec area. Mama Baby Haiti, Cap Haitian, and a brand new birth center in Las Cajobas. The 2 U.S. co-founding midwives are currently in Haiti, along with Carmel Moise, their lead midwife in Haiti. And we were hoping that they could be on the call today, so I'll try to remember to say a couple of things relevant to them in our trends. And then finally, Hispaniola Health Partners. The executive director, Louise Lindenmeyer, is actually there right now in southeastern Haiti, near the coast and the DR border. Okay, next slide, please. So briefly, Global Force for Healing, we are a 501c3 nonprofit organization, and our work right now is solely focused on our Compassionate Birth Network, for whom we mobilize resources, including when it's possible to travel. And Jane may bring that up today in her conversation about the challenges over the last 6 months and having volunteers and the impact of that. We also are very strong advocates for safe, affordable, quality care, respectful care. We're 3 of our board members, including myself, are very active in the global respectful maternal care movement. And then we also do occasionally research and share best practices through publications that are available for everyone. And I'm particularly interested, frankly, in organizational models that work at the grassroots level and capturing those best practices, again, that we have shared out worldwide for anyone that's interested. We are a capacity building organization. And our basic goal is for individual partners, the 17 partners, and for the network as a whole to be sustainable and thrive in their own terms, by their own definitions, with their own community-led projects. So, so they are autonomous, like Midwives for Haiti, and the other 3 partners in Haiti are all autonomous nonprofits that we collaborate with to enable everyone to share resources and thrive. And that includes leading joint programs and collaborations. Currently, we are eager, especially once we're able to travel and do in-person trainings again, to do more, even more in two areas: preventing violence against women and girls, sexual violence in particular, intimate partner violence, and also cervical cancer screening prevention in low and middle income countries. Those are some areas that we have expertise in and where our network has been focusing this year.
Madame Kate bay yon ti rale sou travay ke yo fè, en Haïti, et dans l'autre pays, et nan travay ke yo fè avec jeune filles et femmes, nou te ka wè sa nan traduction, présentation.
Thank you. Yes. So let's get right to the impact of COVID-19. And I'm speaking anecdotally because there is no definitive research yet. However, I feel pretty confident about these trends, both in Haiti and in the countries where we work. Continued excellent quality of perinatal care for those who are able, for mamas who are able to get to a birth center or a mobile clinic. So I think this is really one of the heroic stories of COVID-19 and in general, that midwifery-based care is really doing the job in a most effective and cost-effective way. And I don't want that, that to be lost in the field. Secondly, decreased access to routine health services. And I put a link in the chat box to a July study by Lancet, and it was just updated regarding the concerns about breastfeeding rates going down in the world with COVID, the October Lancet. It's based, their modeling, their 3-scenario modeling is based largely on other pandemics like Ebola, etc. And so this is a great concern, and we're actually seeing it on the ground. The decreased access because of fear of going to a clinic, because even government run clinics, we've heard so many stories where, particularly the first 3 or 4 months of COVID, the staff didn't show up out of fear to either overwhelm and or fear of getting COVID themselves. Several of the countries where we work have been on such a strict lockdown that women, even women that are clearly visibly pregnant, were not able to use public transportation or motorbikes to get to the health center. So that's that, of course, is a concern. The anticipated increase in mortality and morbidity, the indirect effects of COVID may end up killing many more people, especially mothers and children, than the direct effects of COVID. Change in use of midwifery services. Jim, I'm going to ask you to chime in here in a minute on this point and the next one. Mama Baby Haiti has been telling me that they have a huge spike in the number of births and also need for desire for prenatal services. So that's one change. That hasn't been the case with everybody. As I said, limited access to the birth center has, especially in the first 3 months of the pandemic, was a real issue. Same thing with ability to access prenatal and postpartum care, where that's an established routinized part of the package, so to speak, that hasn't always been possible, mainly because of the limits of transportation. And price for success, stress and exhaustion of staff. This excellent quality of care that has continued despite it all has really taken a toll on the healthcare providers themselves, the midwives, community health workers, the administrators. And Jim, I wonder if you would just say a word about the change in use of midwifery services at Maison de Naissance, and also what you meant in your recent email blast about the price for success. Jim Grant. Hello. Well, I'm going to cover the
I
next.
allowed him to speak. Jim,
Oh,
you should be able to speak if you unmute yourself.
Jim, I know Jim is here.
Yeah.
Well, I'm going to go on to the next point then, and perhaps in the Q&A, Jim can chime in about how Maison de Naissance has experienced this change in midwifery services. I think he said that the number of pregnancies had gone down, but, oh, the number of births.
Now Jim is here.
Okay.
Jim is here.
Number of births going down, but the number of other services going up. Jim, what's the price for success and the change that you've seen at Maison de Naissance?
Well, the big change that we saw at the outset of COVID was a huge surge in the number of people coming to our clinic. We've been operating out in the Torbeck Plain area since 2004, and so we've built a lot of community trust. And aside from clinics that had closed either because of unrest or because of COVID, I think the word just got out that people felt secure there. And so we had an immense surge in the number of patients. And for a period, our numbers compared to 2019 were double. In fact, one day we had 500 patients in a single day. And so the daytime staff stayed with the nighttime staff to work through that backlog, so to speak, so that everybody could be seen. The price, though, it's really taken a toll on the staff in terms of the stress, not just the amount of work they're doing, but the fear of COVID itself. And they've done a really good job of managing that. But then on the back end, that means that we've been shipping them PPE supplies monthly since this started, and that gets pretty expensive. For a while, they really just couldn't get anything in Haiti. And so we were purchasing either in the States a couple of times from the Dominican Republic, and then having that stuff shipped to Maison de Naissance. The staff, but it has taken a toll on the staff. And so we have sent them bonuses, COVID bonuses, we're calling them, for their extra efforts. But I'm happy to say, in spite of everything, we've continued on, day after day. It's open 24/7 and hasn't had a single day of closure. But it has been very difficult for them. And we've tried to arrange to have some temporary nurses come in, but we were surprised to hear that they weren't getting very many people showing up to apply, and the ones who did weren't qualified.
Well, thank you, Jim. That's super helpful. And it also, when you mentioned the exorbitant costs also of transportation, meaning how do you get the PPE, for example, to your centers? The danger of getting them on there via the roads is a whole nother issue, as we know, especially for Haiti. But I want to just say something briefly about funds needed for urgent unanticipated needs. Nobody planned for this to happen worldwide. But Marie-Claire, is there anything that you would like to say about this slide before I go forward?
Yes, just quickly. Ça, c'est impact que yo wè nan de COVID-19, bien que ça c'est pas bagay qui basé sur recherche qui publié, mais à partir de l'expérience li, c'est ça que l'ouè, elle pensait que c'est presque même genre pour plusieurs autres organisations qui travaillent avec femmes dans période ça.
Thank you. Okay, last slide, please, Barbara. Our Rapid Response Fund. Global Force for Healing has never done a rapid response or emergency fund before, but talking with our partners, it was clear that that's what was needed most and most urgently. So I'm happy to say that 3 of our 4 partners in Haiti received approximately $2,000. They were 3 of the 10 partners with more funding that we'll be giving at the end of the year for food and nutritional supplementation, clean drinking water, sanitation, extra cleaning supplies, medicines. which often, depending on the country, were bought at higher prices than before with inflation. Extra birth kits with the concern about being able to get to the birth center for the actual birth. Hispaniola Health Partners they used part of their grant to hire a community health worker for community education, extra community education about how to keep oneself healthy during the pandemic. And our basic operating principle, and I think the Rapid Response Fund is really emblematic of that, is that local birth centers and communities know best what they need. Our role was really to raise the money and get it to each of the 10 partners who received $2,000 plus or minus as rapidly as possible. And we've got 10,000 more in the fund that at this date that we plan to distribute before the end of the year. And then I just want to leave open maybe for Q&A, Barbara, what have been the learning opportunities? For example, Hispaniola Health Partners made a point of saying in their report back to us about how funds were used that they had never done any disaster planning. So this was a great opportunity to do disaster planning going forward. So the final slide is just how to reach me. Let's connect. Let's see, where is it? Our Rapid Response Fund, and then there is just one slide that says let's connect. And we can do that at the end if that's better. Because I want to.
Yes, I apologize. If you could type that in the text, I will look for getting that, but I apologize. It must have copied over wrong. I'm sorry.
No problem. Thank you for your time. And I'm excited to talk with folks afterwards.
Thank you so much, Kay, for sharing that. And I appreciate everyone working with these slide difficulties that I'm having a little bit today. My computer is acting up, to say the least, right now. So thank you so much for sharing that overview. Really wanted to have you two go first to share this kind of bigger picture. And then for the rest of the time, we really want to focus on the organizations, that are on the front lines. So next, we want to turn it over to go down to Haiti, to Hôpital St. Croix, and Miss Jean-Pierre Osias Luis Mene, who is the head of maternity at Hôpital St. Croix in Léogâne. And Marie-Claire, I'm going to rely on you a lot for the communication and translation here, so thank you.
Et l'autre panéliste nous, c'est Miss Jean-Pierre Osias Louisemène, qui c'est responsable maternité dans l'hôpital Sainte-Croix Léogâne. Et Madame Louisemène, c'est autant de nous, m'a traduit pour peut-être après chaque paragraphe ou bien chaque information, ou à fait, si pose pour traduire pour, ou bien si vous parlez, si vous fait en anglais. Allez, autant de nous. Madame,
You need to unmute.
Jean-Pierre, get also mute. Est-ce que vous can unmute?
I'm unmuting her, but it won't take it.
Allô, Madame.
There we
Allô,
go.
Jean-Pierre, ou là?
Oui,
Ok, oui, non, n'a pas oui, m'a traduit pour. Vous t'entendez tout à l'heure?
oui, c'est un oui, bonjour.
Good morning.
Et moi, content pour participer dans ce séminaire. Ça. Et, allô?
Vous mettez continuer.
Oui, moi, c'est Jean-Pierre Osias Louismen, je suis infirmière sage-femme. Moi, travaille dans la maternité cette fois en tant que responsable maternité depuis 6 ans et quelques mois. Et expérience en pile. Et concernant, alors, je ne sais pas si je trop vite. Allô? Allô?
Hello, Marie-Claire, can you translate?
Je ne sais pas si c'est trop rapide.
Marie-Claire, we can't hear you.
Allô?
Oui,
Marie
oui,
Claire, are
Nathalie
you there?
Maputo.
Oh, Marie-Claire, we couldn't hear you.
Oh, can you hear me now?
Yes.
Oui,
Okay. Oui, Maputo, madame.
oui. Moi, travaille dans la maternité cette fois en tant que responsable depuis 6 ans et quelques mois. Expérience yo en pile. Allô, maître continuer?
Marie-Claire, can you translate?
Yes, working at doesn't have new information. Go ahead. Oumet, continue, Madame Jean-Pierre Mtando.
OK.
Doesn't think that I hear.
Oui, impact COVID-19 là sur femme yo, femme enceinte yo, c'est que yo vini avec un pile, yo gen un pile stress, les maladies a dehors, yo gen un pile stress, les yo vini dans la maternité, yo stressé, ça fait que tension yo monter,
Okay,
yo gen gros tension.
okay, Fonty pose là. One of the biggest impact that we've seen with pregnant women at our hospital is that they come with a lot of stress, which causes their blood pressure to increase at a irregular rate. Oui, madame, vous pouvez continuer.
Oui, ça cause tension a monter, les vins ba yo maladie que les éclampsie.
And that causes eclampsia in many cases.
Parfois, yo kon vini et puis yo getan fait maladie que les aboussio, ça veut dire placenta getan décollé avant même si on arrive à terme, ou avant même yo arrive l'heure pour faire si mon nan.
Comment le
Aboussio.
Ou ka écrit dans notre chat là, s'il vous plaît. And they come with this particular case that she will write in the chat. If any of you know what it is, where it's induced childbirth, where the baby comes before it's ready. If you know the term for that, the expert on the call, would you share it with
Talking
me?
about premature birth?
Ou ka din mo encore, madame, preterm birth,
Aboussio.
abusio.
Um,
Oh, abrupt.
OK. DPPNI. DPPNI.
Okay. Yes, where the placenta, a rupture of the placenta.
Yes.
Thank you.
Oui, ça vient faire non seulement yo stressé, mais yo peur manger, on sait des bagages, ça vient faire yo anémie.
And due to stress, they are afraid to eat certain food, and that also cause anemia.
Les ça vient ba paquet de problème, les vinn l'hôpital, là de qui peur vinn l'hôpital parce que bon, yo ti les vinn l'hôpital, yo ka ba au piqûre, yo ka mourir, ça fait ou pas venir et puis les vinn pour yo accoucher. Les ça vinn mon anémie sévère. Ça cause problème pour maman et problème pour bébé.
And due to the pandemic, many of them are afraid to come to the hospital, which leads to severe cases. When it's time for labor and delivery, then they come already with cases that it's too late for the mom and the baby in many cases.
Et parfois, c'est difficile pour nous en pile la maternité parce que Haïti a un problème, nous avons besoin de sang, pour qu'on voit des sang pour mon et puis pas de sang pour lui, pour qu'on retourner mon à la vie parce que c'est tellement et problème, mon yo anémie, yo pas bail sang à quoi ou genre qu'on bali là encore. Ça cause parfois qu'on garde ouais mon a mourir pour pas faire rien pour lui.
And because of the situations in Haiti, many of these people we cannot save because we don't have enough blood to help them out, especially when they come with anemia cases. And sometimes it is sad to just see the person pass away without being able to do anything. Vous continuer, madame.
Oui, parfois, Jean, docteur Clététria, c'est si moun yo kon enceinte, yo lè yo vin, yo pa di parents yo ça, et puis yo gen doit prendre médicament. Yo font avortement, et puis yo rete la kay yo, y a bay sang, yo caché ça, yo pa kite parents konnen. Mais des fois, là, yo vin l'hôpital, c'est là, on a état grave, là, ça parents ka ouais ça, et puis yo couru l'hôpital avec yo, là, ça, yo gen tan grave. Parfois, il y a des gens qui ont 2 grammes, 3 grammes à l'hôpital.
And as Catherine Adams said earlier, many of the young girls, they are pregnant and they are hiding it. Their parents don't know about it, and sometimes try to do an abortion. And when the parents bring them to the hospital, then it's too late. And we've seen many of those cases where sometimes they come with combien de grammes sang? 2 à 3 grammes sang?
Oui, 2 à 3 grammes.
2 to 3 grams of blood, and many cases it's difficult.
Oui, là, ça c'est dans l'oxygène, obligé de mettre météo pour voir comment on peut voir des sang pour eux. Parfois, les organes pas gain, c'est pas au prince pour voir à quoi ou central pour voir des sang pour eux.
And many of the times we try to put them on oxygen and send to Port-au-Prince to get blood. It's not always guaranteed that we will find it. Yeah, that's the case. Those are the cases that we're seeing.
Les bails ça arrivé, yo très stressant pour nous dans la maternité parce que les gens n'a pour y aller sans pour lui parfois les gens n'a bloqué dans route bien blocus il pas arriver tout ça c'est problème lié dans la maternité mais quand même nous dégager nos gens nous connaît pour nous voir comment nous ca aider au sortir.
And in some case it is stressful for us the caregivers, because sometimes you're sent to get blood and there are other issues along the way and it's too late and we don't get the supplies or the resources at the right time. But with the experience that we have, we try to do whatever we can with what we have to try to save lives, but it's not always positive, or we don't always find the solution. Oui, Madame Jean-Pierre, on continue.
Oui. Et puis l'autre bagaille, il y a mon tout, yo rete la caillou parfois yo pas aller à l'hôpital, yo peur venir l'hôpital, des fois les mon vient prendre l'hôpital pas venir, yo peur comme si yo gon peur pour l'hôpital, mais en pile fois c'est l'air des fois mon a accouché la caille, les ça au temps pour aller courir l'hôpital avec, et puis nous même pour nous faire et le mieux pour eux.
And as I said before, pregnant women are afraid to come to the hospital. They think that they are going to die. Some of them start labor and delivery at home, and well, many of those are happening right now where they stay at home. But in some cases, they bring them when it's probably too late.
So thank you so much, Jean-Pierre, for sharing with us and being with us today. If anyone has any questions for her, you can type them in the chat or the Q&A, and we'll get Marie-Claire to ask them and get those answered either live or afterward. But it's always wonderful to hear from the front lines exactly what you're seeing. It's really heartbreaking. Thank you for being with us.
Merci en pile, Miss Jean-Pierre, pour toute information ça yo. Si gen moun ki gen question, nou ka toujou ekri yo nan chat la. Et merci à tout l'autre moun yo tout qui t'ai aidé avec terme que m'te gen problème avec. Thank you to all who helped with the term. That was very helpful.
Okay, merci.
Thank you for the translation. Appreciate it very much. with this topic being labor and delivery, there's always emergencies. We did really want to hear from Miss Carmel Luis from Mama Baby Haiti today, but they have a lot going on right now, and I don't think she is going to be able to join us. So I did want to mention them. Go ahead, Marie-Claire.
Et merci à tout le monde qui participe déjà. Nous t'ai vraiment voulu entendre de la part de Mama Baby qui c'est un centre de naissance, un centre d'accouchement, mais malheureusement, ils ont vraiment occupé dans le moment, ils n'ont pas qu'à partager avec nous. Nous bien apprécié que l'information que Madame Jean-Pierre t'a partagée.
And now I want to move on to our next panelist, who is Jane Drichta, who is the Executive Director of Midwives for Haiti, who, as you will learn, is very responsible for a lot of the great midwives that are working throughout Haiti. So Jane, I'll turn it over to you.
Oh, thank you so much, Barbara. I am certainly not responsible for it. The programs that have been set in place since 2006, when Midwives for Haiti started on the ground in the Central Plateau, have certainly had a big impact. But of course, it is our Haitian staff and our students, which I will brag on more in a moment. So as I said, we've been on the ground since 2006, Midwives for Haiti. We have several programmatic arms, the main one being the Nadine Brunke-Eads School for Advanced Obstetrical Studies. And this is a school that we take Haitian nurses, and through our 18-month program, we magically turned them into trained birth attendants, into midwives. It's a fantastic program. We've just revamped the entire curriculum. It's now in line with all of the International Confederation of Midwifery standards. And so we were very excited to roll it out on its inaugural year. And then COVID happened. So this is a lesson, obviously, in rolling with the punches. So as I said, our main programmatic arm is the school. We also have the Carrywortham Birth Center, which is out in Capistor, so a very rural birth center. We use that as one of our main training areas for our students, but also we have 24/7 coverage, obviously, for direct service delivery. We also have 8 community clinics that are done in partnership with NSPP. We used to do mobile clinics, and this is a new program for us, less than a year old. So it's been an interesting transition and one that's been quite successful. We also run all of the maternity and reproductive health care at Hôpital Saint-Therese in Inch in the Central Plateau.
Et Madame Jean Drichta a partagé le travail que vous faites. Un plus gros travail que vous faites en Haïti, c'est infirmières qui déjà formées, yo formation pour yo ka devenu sage-femme. Et ils travaillent dans plusieurs zones et ils vont parler plus de qui ça ils fait.
So I think what you're hearing from a lot of different voices, and it is true, is that while COVID-19 has affected all people in the world, I don't think you'll find a single person on the globe who it hasn't affected in some way or another, but it has not affected people equally. And it has exposed some of these structural inequities and inequalities to the extent that it shocked even those of us that have been working in global public health for a very, very long time.
Et il y a un bagage que nous entendons en pile, c'est façon COVID-19 est impacté tout le monde et il est vraiment difficile, même impossible, même pour nous avoir rencontré un monde dans le monde là qui pas affecté en façon ou en l'autre avec pandémie ça.
And there has been research done on this. Researchers know this, that there's an unequal response to a pandemic event, particularly Davies and Bennett, who provided a really, really intense gendered human rights analysis of both Ebola and Zika. And if anybody wants that citation, I can certainly give it to them. But the evidence that they presented warns against a gender neutral response to pandemics. And yet this is exactly what's happening all over the world, and particularly in Haiti. There is not a gendered response where we focus on the rights of women and the voices of women during this particular time.
Et bien que il affecte tout le monde, mais il pas affecté tout le monde même genre, il pas affecté tout le monde également, sous même niveau. et gagner des recherches qui fait pour montrer ça et gagner un bagay que peut-être yo pas focus sur lui c'est voix femme pendant moment pandémie.
I will say that the pandemic is disproportionately affecting our patients who, of course, are female, usually young, although not always. The majority of our patients work in the informal economy, so they don't have official jobs. They may sell vegetables. They may work in a hotel as a maid. These are very unofficial jobs that are very not reliable. And with the pandemic, a lot of those jobs have completely gone away.
Et pile femme qui en pile fille que nous rencontrons qui affecté avec COVID-19 c'est mon en pile pas gain au travail que nous t'avons dit qui sont travail bureau ou bien qui régulier c'est monde qui fait petit job à côté ou bien monde qui vend petit bagay pour manger et gen yo qui travaille dans hôtel ou bien côté qui a fermé que yo vinn perdre si travail yo.
And I'm going to piggyback on what my colleagues said, that our healthcare workers, our midwives, our matrons that we train, that we have great relationships with, they are mainly female. And I will say of my 65 Haitian staff working in the Central Plateau, 28 of them were infected with COVID-19.
Et moi gagné nous travaillons dans le plateau central en Haïti et dans 68 staff qui étaient gagnés, 28, 68 and 28.
28 out of 65.
Et dans 65 que nous gagnons, il y a 28 qui étaient infectés avec COVID-19.
And I will tell you, with the way that the testing has been globally, the testing across the world has been not very reliable. I suspect it was even more than that.
Et de la façon que les tests ont été faits là, non, yo pas tellement, yo pas qu'à gagner plus cas que ça que nous-mêmes nous ouais.
And I think it was Jim who was talking a little bit about how staff were afraid to come into work due to infection issues, and we certainly saw that as well. A lot of our staff, they all showed up, I'll give them that, but they were very frightened. We did have PPE for them. We do have N95s. We do have disposable gowns, this sort of thing for them. But it was actually terrifying for them to watch their colleagues fall to this virus. Luckily, we had no deaths, but it was a very, very intense time. And you add on to that also the people that were forced to quarantine due to exposure to their colleagues, and it is still a staffing disaster.
Et j'en te dis que l'impact là est plus que ça. Donc, il y a un pile monde qui peut aller travailler. Il y a un monde qui t'a parlé avant, tu mentionné ça. Mais tout le monde nous te venu travailler. Cependant, il crée un pile stress, il était difficile pour nous gérer la situation. Nous pas de gens qui mourir, mais l'impact là les mêmes les
So the women are getting hit from both sides, both as patients and as staff. Just like us across the world, and as you all know, the schools have been closed in Haiti. That included our postgraduate training program, and it also included all of the elementary and secondary schools as well. So our patients were having to deal with all of their children being at home, dealing with the fact that they really don't have a lot of internet access, so distance learning was not really a thing that could be done for either our patients' children or for our students. Many of our patients are illiterate, so they cannot provide formal educational guidance to their children. So you can see that these gender inequalities will now affect the next generation's inability to escape generational poverty.
Et si nous regardons ça de façon qui est plus large sur question de genre et gagner un pile ni patient ni prestataire yo affecté avec situation ça un pile petit monde qui était la caille parents yo un pile dans monde que nous travaillons avec yo qui pas connaît li qui pas connaît écrit ça vient faire vraiment yo pas qu'à aider petit monde yo dans l'école et nous ca ouais que après plusieurs générations, même situation ça a continué à produire.
Many of our patients and a few of our staff have also told us about increased incidence of domestic violence, which of course is expected in any type of humanitarian emergency, unfortunately. In fact, the UN is now calling this the shadow pandemic. Domestic violence is the shadow pandemic of the COVID-19. I think it was Kate Winslet was the spokesperson. She's an actress who did a bunch of PSAs for the UN talking about the increase in domestic violence and where to go in different countries for help.
Et yon lot nan gros impact que nous rencontrons, c'est violences domestiques qui viennent monter. Et UN, Nations Unies te fait une recherche, te fait une étude sur ça pour montrer comment ça vient affecter, et pas seulement en Haïti, mais en plusieurs côtés dans le monde là, côté que COVID-19 là. Il y aurait l'ombrage, pandémie, l'ombrage COVID-19 et 19 là, parce que à cause que mon yorité la caille, ça vient ajouter sur violence domestique qui existait déjà peut-être.
And again, just to echo what my colleagues have been saying, at first our census was down when it first started happening. So we're talking about end of March, early April, our census was down. People were too afraid to come in. They wouldn't come to the community clinics. They wouldn't come in to deliver at St. Therese. Not so much out of the birth center. They kind of kept still coming at the birth center because we were pretty much the only game in town out there. So the fact that the census was down does show that the pandemic was a barrier to accessing reproductive health care. But now our numbers, much like Jim said, they're through the roof. I've never seen such numbers in our monitoring and evaluation. It's really incredible. It's way up. Our birth center usually does about 20, 25 births a month. We had 7 in one night. Like it's absolutely been incredible. The amount of people that are coming in. And of course, you add that onto the stress of staffing. And whilst most of my staff has recovered, we still have the odd exposure now and then where people have to quarantine for 10 days to 2 weeks. And it's quite stressful for them.
Et c'est vrai, dans le commencement pandémie, les gens ont peur aller à l'hôpital. Et m'a mentionné ça, il y a un monde qui dit que moun yo te peur, yo te pensé que docteur pral ba ou piqui COVID-19 là, qui a antigen dehors de ça, Madame Johnson dit. Et I will say, when you said people were afraid to come to the clinics, somebody shared that they believe that the doctors will give them the COVID-19 shot. And that was one thing that Ms. Jean-Pierre mentioned, and I didn't quite get it about the shot, but they were afraid that they will give them the disease.
We are definitely hearing that, and there's been a lot of health education around trying to dispel those rumors. It's an uphill battle.
Et ça, un peu le monde entendait ça, c'est des rumeurs que nous avons essayé pour nous clarifier pour nous qui ça veut dire, comment pour gérer la situation ça.
In speaking with my colleagues who work in primary care, their numbers are very down. So people are not coming in for their regular medication management. They're not coming in for their regular screening. And that is being shown with our women when they come in to give birth. We have women that have a lot more comorbidities than we would ordinarily see.
Et quand nous venons gagner plus femmes qui viennent dans l'hôpital, nous avons gagné 25 par mois, 25 accouchements par mois. Quand il y a une nuit, nous avons même 7. Et gagné un pile fille, j'ai collègue nous te dit avant, qui pas venir à l'hôpital, ça vient cause que yo pas te suivre traitement que tu as besoin pour le traitement prénatal que tu avais besoin avant accouchement. Et
we lost 3 women in 2 weeks at St. Therese, which is unheard of in the past few years for us.
Et dans l'hôpital Sainte-Thérèse, nous avons gagné deux femmes, 2 mamans qui mouraient. C'est un bagage que nous pas jamais, bon, pour pendant pile temps que nous pas jamais entendu dans l'hôpital Sainte-Thérèse qui passait malheureusement.
So I think it's quite obvious that these stories are out there. You know, you've got me telling them, you've got Jim, you've got our Haitian colleagues, you have everybody on this panel talking about the stories from Haiti. And these stories need to be told. And they need to be told by the women who are experiencing it. We need to talk to patients. We need to get lived experience. We need to get these stories out there in their own words. Women must be represented at every single level of COVID response worldwide, be that local, be it national, be it international, and they're just not. The gender norms and roles across the world, but particularly in Haiti, they influence women's differential vulnerability to this disease, and this has to be acknowledged by government, by civil society, or the next emergency is going to be even worse than this one.
Et nous tendons un pile histoire, tout le monde qui parlait là, nous tendons de la part de Haïtiens, de monde qui parle haïtien, et c'est pas seulement en Haïti que ça a passé. Il est important pour nous tendre histoire ça de la part de femmes, yo, monde qui vivent situation dans propre mot yo, pour nous comprendre situation. Et il est important pour nous bailler filles voix pour yo parler de pareil ça qui a passé pour yo joindre aide puis une solution que you besoin.
So I thank you so much all for your time who are able to listen to these stories, and I will look up that citation. I'll put it in the chat, and thank you very much for coming today.
Et merci pour attention nous. M'a mette une citation que m'te dit sur une recherche qui était faite, m'a écrit pour nous gagner accès à lui et puis merci beaucoup.
Thank you so much, Jane. I mean, I've just been amazed by every panelist going from one to the other, learning something new from the different perspective, but all summed up very well, Jane, and how they are really affecting women disproportionately. And at the end, we'll get into more of what you started there of, you know, what can we do? Is there anything we can do? So thank you very much. I really appreciate everyone. We have one more wonderful panelist to introduce today. It's Miss Catherine Gray, who is with Soaring Unlimited, who is a family nurse practitioner, and we're going to have her share a little bit about their work in Haiti and what they are seeing as well. So Catherine, I will turn it over to you.
Bonjour, everyone. I have very little to add to all the wonderful things that I've learned today myself. As a family nurse practitioner, I do not have the maternal child health expertise that my colleagues have shared today. Thank you, Haiti Health Network. Thank you, Dalton Foundation. I have grown myself personally through the panel discussions and the webinars that we've done on Monday evenings. That's been a really big help. What I hope, as I'm sitting here thinking about what am I going to say, because I've heard from these experts and I'm not an expert, is maybe it is hope that I can offer. Soaring Unlimited is a 501c3 that has been in Haiti, boots on the ground outside Cap Haitian in a very rural mountain community called Pister for over 25 years. And we have a medical clinic that's coming on 12 years of being in existence. And I got involved as a clinician when it came to the wanting to volunteer at the clinic. Next slide, please. As a adjunct clinical instructor for Michigan State University, that's how I found myself in Haiti. And the experiences that I had just caused me to fall in love with the folks that I met down there. Next slide. What I've learned about being in Haiti and what I hear again today is the importance of collaboration, whether it's collaboration on a Monday night with the Haiti Health Network and hearing from all of you that I've met through the Haiti Health Network, or just hearing today about how you have collaborated with one another, is to know how we've come this far as Soaring Unlimited. This is a photograph of a picture that we had taken several years ago now. It's about 3 or 4 4 years old now. But we have asked our community, whether they want to do, what do they need. And after the building of the medical clinic and seeing what a source of reference that was for the entire community, for education, for nutrition programming, for gardening programming, for a library, for the building of a school nearby, they told us that they needed a maternal child health center. We heard numerous stories about how every person in this leadership panel came together telling us that they had a wife, a mother, a sister, a daughter who had died during childbirth. So when I hear you tell about what your maternal child health clinics, your midwifery clinics have accomplished, and how the trust of the community has caused people to gather and have more access to care during the COVID pandemic, that makes me realize that it's so important that nursing has a huge role to play, and midwifery has such a huge role to play in a society such as Haiti. And so we asked our leadership group, and they said we need a midwifery station. And so we have gone ahead and collaborated not only with Midwives for Haiti, where our own midwife comes from, or Mama Baby Haiti, which is down the road from us. And they have been very, very helpful, with Pro Famille, which is an organization which is providing family planning methods for our clinic. And next slide, please. With Building Goodness Foundation, which we found out about because of the trip that we took to Midwives for Haiti, we are going to be building a birthing clinic. We raised $500,000 and we're ready to break ground next week. So there's the hope. What we thought long ago was important, that we teach the people to fish. Now we realize, because we haven't been able to go to Haiti and be there with our Haitian staff, guess what? They can fish already. They have done an amazing job. They have kept this clinic open every single day. I think they missed 2 days, and it's not so much that they didn't go to the clinic, they couldn't go to the clinic. It turns out that the president of Haiti, Jovenel Moise, has a banana plantation about 4 miles down the road, and so there was blockades around the road. So they have kept the clinic open. Like many of you, we have struggled to get PPE into the clinic. We've struggled to get medications into the clinic. We have, we saw the initial decrease in numbers of patients for exactly the reasons that I'm hearing from you, that people didn't believe that there really was a coronavirus. They didn't believe that Haiti had the COVID virus. They were afraid that they were going to come to the clinic and get it. They were going to get the nasal swabs they believed were actually shots of some sort. We were fortunate to have the hospital in Milo near us to be a resource for actual testing. But it sounds like our staff didn't really send many people to the clinic or to the hospital because people stayed away. Unfortunately, we saw a decrease in our prenatal programming. We saw a decrease in women coming for family planning. We were not giving away nearly as much birth control pills, which people aren't all that happy about, but we weren't getting as many depot shots. And as a matter of fact, our own midwife missed a month because she got pregnant and had a baby. So like you were all telling us today in this webinar, the impact of COVID has certainly struck. But now people are coming back. People are coming for their blood pressure medications. People are coming for prenatal and postpartum care again. We are doing, next slide please, we're back to doing our Matuan program. We realized that it was going to take us a long time for us to raise the money for this clinic, and so we started doing things like education programs, like nutrition programs, a Matuan training program, a certification training program that we again learned about from our midwife, Vadli Ducton, who was actually a graduate of Midwives for Haiti. And we're training our second class of midwife, or of Matwans, and they are the ones who are in action in the field. Another thing our staff has done has actually been to do mobile clinics on the days when they couldn't get to the clinic, or when they determined that there was more need in the neighborhoods than there were actually at the clinic. So on their day off, which is market day, which is a Wednesday, they have had several mobile clinics, which they truly took the bull by the horns, and they did what they needed to do to help their neighbors. And we are so proud of them. We couldn't be more proud. Oh, I've been talking and talking and not letting Marie do the translation. I'm sorry.
That's all right. I can give a quick overview. Madame Cathy Gray t'a bay yon qui travail que vous fait et puis qui même avec tout le monde qui impact que rencontré avec COVID-19 dans côté au travail là, et c'est presque même histoire yo avec tout le monde qui t'a parlé déjà yo, mais yo même et travail c'est yo travaille avec yo bay ça lui même les focus sur les plus c'est bay l'espoir à monde vraiment qui perdu l'espoir pendant situation ça.
Thank you. Sorry about that. It seems like there's so much to say, and yet very little more to say. This is a slide of the Michigan State medical team that was down there, but it's been now a year and a half since a team has been down there going on. It'll be 2 years in November that we have not been down to teach the students, as well as because they're given Global Health Institute credits, academic credits for their time spent down there. They spend time at the hospital in Milo, Sacré-Cœur. I think Dr. Prevail is on this call. Greetings, Dr. Prevail. And so we're anxious to get back on the ground. As I said, hopefully this coming week, Building Goodness Foundation with an all Haitian staff is going to begin the building of the birthing center, the maternal health midwifery center, the picture of which you saw. And so there is hope, and we certainly do hope and pray that we have the kind of trust that your clinics, my colleagues on this panel, have expressed, where the local people trust and bring their concerns to your nursing model clinics. So thank you for allowing me to be on this panel with all of you.
Et merci en pile. Et les gens m'ont dit que l'organisation nan bay espoir, côté pas l'espoir, il fait ça surtout à travers l'éducation dans la communauté.
Thank you, Catherine. I have to disagree with you. You did have some valuable, very valuable things to add. I think it was a perfect ending with you sharing how Soaring Unlimited is doing some very practical things to try to bring about solutions to a problem, and touching on the idea of collaboration, which is what we're all doing here. And I love seeing how everyone, even on the panelists, are all working together and how each one has a piece to make the whole. And it's incredible. So I thank everyone for being here. Just a quick housekeeping item. We kind of officially end at 1, but we are certainly happy to go past that. I just know that the panelists may have to hop off. We will share the slides. Kay, I will correct your last slide and it will go out properly. We will also send out all of the references that people have made so that you can have them. And God willing, this video is being recorded and we will share the recording as well and put it on YouTube. So we want people to access information. I do want to spend the last few minutes on some Q&A. I'm going to go back to the middle, back to Catherine Adams with a question that has come up to me several times. I've seen it in the chat and it's also come over my email, is regarding birth control, Catherine, and why men are so against birth control. Where is that coming from?
Yeah, thank you. You know, we actually asked our girls and surveyed our girls about, you know, the issues around pregnancy and using birth control. And what they said was that guys actually brag about getting girls pregnant. They see it as a sign of their virility. They see it as a sign of disrespect from the girl if she is not willing to have intercourse with them without protection. There is huge reluctance to use condoms, even with the prevalence of STDs. That the complaint is that its sex is not as good, and the culture is such that the girl supplicates to whatever the man's wishes are. Quite often I will see with some of the girls this almost desperation not to lose this guy, and willingness to do anything just to keep him. And so that is part of it with birth control. Many girls are afraid to use IUDs because they're afraid that the guy will feel it and sense it, and then they'll get in trouble from the guy. Same with the implants, because they'll see it. So it's almost easier to convince girls to use the pill, but then of course you're still not protecting them from STDs. You know, the condom is the best way to go. So yeah, that comes up frequently with them.
That's so interesting. Thank you for sharing that. Now, I do see that Tanya Robbins has her hand up. And Tanya, I think I've made it to where you could speak. So do you have a question or comment you'd like to share with the panelists?
Oh yes, hi everybody. Thank you so much to all the presenters. That was a really interesting look at how COVID has affected maternal health in Haiti. Just to introduce myself, because I haven't met any of you before actually, but I'm an obstetrician from London, and I'm a researcher based at King's College in London, and I've been doing some work with a team in Cap-Haïtien around trying to improve community level education around preeclampsia, and really I just wanted to share some resources that we've designed with the community in Cap-Haïtien that we're basically trying to address some of the issues that Ms. Jean-Pierre was mentioning, and I know these issues are very complex, and as many of the speakers mentioned, COVID has kind of revealed even further the iniquities that exist in particularly around maternal and reproductive health. But basically what we've done is we've made a short drama film about some of the barriers that women face in trying to access appropriate care for well, generally for maternal health, but particularly the film is around preeclampsia. And we've also made some short information films about what is preeclampsia, what it means for you as a woman, and what it might mean for your baby. So I'm just basically, we're at the stage of trying to disseminate it as these resources as widely as possible. And I'll certainly be in contact with some of you, maybe via email, to see whether we might be able to kind of integrate these resources into your existing work at community level. But I'll put the links to the films which are openly available on YouTube in the chat box now, and if you wanted to have a look, and we're really open to any feedback. So thank you.
Thank you so much. Yes, please post those. And again, we'll pull them out and put them in the email, because as y'all have probably learned with Zoom, as soon as we close out of the Zoom meeting, probably only I will have access to the chat. So I will make sure that that's available to everybody. So
thank you so much. And just to say, this film was made on a very small budget, and it's actually made with, not with actors, but with members of the community. So just bear that in mind when you're watching it. But actually, I think that sort of helps it speak to the people that it hopefully will speak to when
that's
it's shared
better.
more widely.
Yeah. Even better. Perfect. Thank you.
Thank you.
We did have one question come over from Danny, that one of the panelists mentioned temporary nurses may be needed at Maison de Naissance, and the question being, how can a nurse in Haiti apply for such a position? So I don't know, Jim, you are still with us to answer that question, or one general answer is if you want to reply to me at info@thehaitihealthnetwork.org, which I'll type in the chat, I can forward information on. But Jim, if you're with us, I'll have you share.
Yeah, I'm still here. Well, I should say first that we've gotten past that point. And I think that the issue was that women were afraid to apply for a job at the center because I think they thought that would raise their likelihood of coming in contact with COVID. But in the meantime, usually what we do is, I mean, we have temporary and nurses that sort of are on a roster that we can contact when we need help because maybe staff is on vacation or maybe on maternity leave, things like that. So usually we just sort of put the word out into the community that we're looking to hire temporary staff, but this time is the first time that we've, had so few respondents. In fact, only one or two who, as I said, weren't qualified, but we have gotten past that. Normally, it's not effective for us to advertise an opening that's temporary, any farther than the local community because people aren't going to relocate for a 1-month job or 2-month. In this case, it probably would have been 5 or 6, but we didn't know that at the time.
Thank you, Jim. Thank you, Jim. And I posted in the info email for the Haiti Health Network. That goes to Dr. Kaplan and myself. And we do try to share information and connect people in any way that we can, whether it's employment or just connections in general. As I think everyone said it in some form or another, the importance of collaboration and connectivity in being effective in making some lasting change in Haiti. And I know it is one, and I know some people have hopped off, but I did want to end with one last question, just open to all the panelists to be able to share. And again, some of you have already touched on this, so we've sort of already answered it, but any last thoughts to leave with everybody about what some of the solutions are to the problems and challenges that were presented today? Is there anything, I know we talked about education and some other things, but is there any last things that y'all would like to say about that before we sign off today?
Well, this is Kay. Oh, I'm sorry, Marie Claire.
Just for Miss Jean-Pierre. Miss Jean-Pierre, dernière question, c'est si ou ta vagé un dernier bagay que ou ta aimé partager pour tout le monde ta vagé en tête avant. Mais gen l'autre monde qui pral parler après ça, si vous voulez dire un bagay ou a dit la après.
I just wanted to mention quickly, and I do need to hop off in a minute. As Jane also mentioned, the importance of advocacy and awareness around the social determinants of health, as we call it in the U.S., around the inequities, which I think is a real opportunity now that not only the global pandemic of poverty that we all know exists, but also the dual pandemic, if you will, that affects women and girls and children more. I think this is a real opportunity, not just for education, but for advocacy. And funding, and really working with funders of all levels to see that now a little bit can go a long way in making a huge difference in addressing, in closing some of those disparities or gaps.
Thank you. Any other panelists have any last thoughts on that?
I'll just chime in for one moment. It really all goes back to relationship building. No matter what the problem is, whether it's a pandemic, whether it's lack of birth control, whether it's lack of access to direct service delivery, it goes back to relationship building, and it cannot be rushed. The dinners, the drinks, the speaking with your clients, with your patients, with your community members, these things are just as important as shoving a Jardel in somebody's arm. It really is. So I love hearing all of these stories about how these organizations have been embedded in the community for quite a long time. And it really does warm my heart because we do all need a bit of hope. Thank you, Kathy, for that ending.
I wanted to just add a couple things that kind of came up from other people, but that I wanted to echo. The reaching out to the community through mobile clinics, through home visits, and postnatal care. So it's something we didn't really get into a lot, is that this is going to bring up a huge need for postnatal care. And often we will have someone go home and have complications, or the child gets sick and the issues come up after they've seen a clinic. And in the rural areas especially, and because of the inequities that this has revealed, we need more opportunities to reach out and bring healthcare into the home, in a sense, and bring it to them. And the other thing that came up a lot was the stress on the caregivers. I know at LEAD, a second component of what we do is actually training other NGOs and people on impacts of trauma, as well as on self-care for caregivers. And that has come up over and over again during this time. And so I think as we ask more of people who are already doing so much, it's important that we also take care of them along the way.
If I could add just one more thing, at Soaring Unlimited out there in the country at the base of the mountain, one of the things that we have used as an incentive to get the moms who have new babies to come to the clinic for postpartum care is to offer them a baby box. And so they're given a cardboard box, which is covered in plastic, and a small layette, and it introduces them, and sometimes for the first time, to the clinic, and it's the start of a relationship. And that's because the Matouans that have been trained now encourage them to come to the clinic for their baby box. And in turn, the Matouans are given a new, fresh birthing kit. So, incentives.
All right, thank you again all so much. I have had really a lot of slide problems today, but for last ending, just real quick, I want to make everybody aware of the Haiti Health Network website. We encourage people to use it. There is this orange button here that you can use to search for healthcare resources throughout Haiti. The Dalton Foundation has been really I think it's really important to map all the healthcare services in Haiti, what's where. Obviously, we are very passionate about this idea of connecting. So I believe all of your organizations should be in here. If not, shame on me. And I will make sure they're all in here. But they're in here for people to be able to find you and the services you're doing. And so I think it's really important to just create quick awareness on that. We do have a calendar also on the Haiti Health Network site where you can post any upcoming events. We know with COVID, a lot of events have not been happening, but if you have trips coming up in 2021 or whatever, please, we encourage you to post them. And then a couple of you made reference to our Monday night calls, you know, beginning in March. Actually, Dr. Kaplan led this, and I'd say that he gets credit for starting us before the first case ever hit Haiti. We were having these weekly meetings, and we kept them going every week until just in September, we just started switching it to every other week. And we've broadened the topics to where we are still making sure that COVID is not overwhelming anybody, but we've expanded the topics. We've been talking about the effects of the currency rate change. We've been talking about the effects of violence. We've been talking a lot about these side effects of COVID and how they're affecting women and other groups. So we encourage people to join us on these. Our next one will be October 26th, because we just had one 2 days ago. And then our webinars, obviously you participated in this one. Everyone, thank you. We do have one next week, which is going to be a smaller one. It's an actual training, which is a follow-up from our medical equipment webinar we did in August. We had so much requests for a software demo. We're going to be demoing that software next week. And then our November webinar will be on November 12th, most likely. And we're going to talk some more about medication management, not necessarily on the patient level, but on the facility level, and how to do some things to improve that for sustainability. And then in December, we are very excited about doing our first really formal clinical lecture, which will be on this topic of women's health that will cover bleeding. So we are going to encourage all of our members to help get their Haitian staff on this call. It will be fully translated, but we're excited about that first topic. And you can see we're working on January and February, and I think we even have March going. So excited for all the planning and everything that's coming up. So thank you all again. Y'all were an excellent panel. Every time I learned something new, and I'm really grateful. So thank you all, and have a wonderful rest of your day.
Thank you. Bye-bye.
Bye-bye, everybody.
Merci tout le monde.
Thanks,
Bye-bye.
Barbara. Thanks, Ted.
Bye-bye.